This is One on One. We're pleased to welcome Kristen Silberstein, Vice President of Patient Engagement and Chief Experience Officer at Holy Name Medical Center. Good to see you.
Nice to see you. Thank you for having me.
Break this down for us. Vice President of Patient Engagement, what does that mean?
Well, can I take the experience piece first?
Yeah,
That's
do that
a little
one first.
easier to explain to
sure.
folks because that's the piece that most people relate to. And in my mind, the experience is what happens to a patient when they enter our walls. So how does the front desk greet you? Were you able to find your way? Did the nurse communicate with you? That all builds to the patient experience. So what I've been brought on board for is to look at the non-clinical interactions that our staff are having with patients and their family members, and making sure that those non-clinical interactions rival the wonderful clinical experience that the patients are enjoying.
Why is that so important?
That's important because that's really what drives patient satisfaction. So the overall experience that a patient has is what's going to determine how satisfied they were with the care they received. That feeds into engagement. So why the experience is so important is that a satisfied patient, what we're hoping to do is turn that into a loyal patient. And that's really where the engagement piece comes in. The engagement piece, in my mind, is building on the relationship we established when the patient was in our hospital. So,
Give me an example of engaging them.
for example, a patient leaves Holy Name. We're able to push out information to them to help them manage their disease. We're able to connect them with physicians in the community to help them manage their disease.
Could you also check up on them to see how they're doing?
Absolutely.
Engage, connect.
Connect with them. And in our ideal world, connect with people who don't need care right now. So prospective patients. So we're reaching out into the communities to engage those folks, to get them thinking about Holy Name before they need care.
In so many ways, this is about relationship building.
Absolutely. So healthcare is really undergoing an important paradigm shift. We are shifting from a procedure-based, payer-based relationship.
Transactional to?
Very transactional, to a more patient-consumer relationship-based model.
Is that hard for, you're articulating, you're coming into Holy Name, but for others who are so connected to, dare I call it, the fee-for-service model, do you think it's more challenging for some?
It's challenging for some. Change is hard for everybody,
it sure
right?
is.
So, and especially for those of us who have been in healthcare for many, many years, it is an industry undergoing unprecedented change, especially with the advent of the Affordable Care Act.
Right.
So that's really forced the issue. It's forced consumerism in healthcare. Consumers are making more decisions now than they've ever had to make in the healthcare space. They're choosing where to spend their premium dollars, right? They're shopping on the exchanges, a lot of them, to find a policy that suits them. But because of the advent of high deductible health plans and more cost shifting being pushed to the consumer, they're also deciding how to spend those precious healthcare dollars. And you can be sure that if they don't have a great experience, they're not going to come back and spend those dollars.
You know, Mike Marin, the CEO of Holy Name, and I have had a lot of conversations about diversity and about cultural diversity. Mm-hmm. And I know that at Holy Name, this is a big theme.
Piece.
Talk about that and what that has to do with engagement.
Sure. So when you look at the patient as a person, you need to not just look at why they're coming to you, not just look at their disease state or their diagnosis. You need to look at them as a person. You need to understand where they're coming from as a person. And there's a big cultural awareness piece of how you approach that patient. So what Holy Name is trying to do is build that awareness among its staff and do that education so they can understand that certain cultures,
such as the Korean community?
The Korean community, the Hispanic community, the Orthodox Jewish community, all of them approach healthcare in a slightly different way. And it's really trying to understand where they're coming from a cultural perspective, and meeting the patient in that space.
It's so interesting because we've had the leader of one of those initiatives, the Korean initiative.
Kyung-hee?
Yeah.
Yes.
And it struck me that, like, you could say, here we are, come to our medical center, come to our hospital. Or you could want to understand a community and understand the unique challenges they have, which is a totally different approach. But that is in fact important, because the way I often think about this, the way you treat a patient has something to do with culture, no?
Absolutely. And maybe to put it in a simple context,
Sure.
We all know the golden rule, right? Treat others as you want to be treated. But in a patient engagement world, it's really trying to treat them the way they want to be treated.
Not the way you would want to be treated.
Correct. I mean, everybody, we should all be nice to one another.
Yes.
We should all look out for one another. That's not really what I'm talking about. But it's, again, trying to understand where that patient's family is coming from, and treating them in a way that they're comfortable being treated.
Talk about the sandwich generation.
That's a challenge. So the sandwich generation is, they're
What does that mean?
approaching. To me, the sandwich generation are people probably similar
Yeah.
to the boat that I'm in, looking at that parents who are starting to
Yep.
age, dealing with that aging process, dealing with planning.
Yep.
A relative of ours is recently diagnosed with early dementia. So again, trying to help navigate the system.
We're there too.
Yeah, as well as taking care of yourself and
Yep.
your children who are in high school and
Sandwiched.
college, and you're sandwiched right in. So I think that there's a great need in our healthcare space to begin providing at least education in terms of helping folks navigate the choices that they have, looking at long-term care solutions, those types of things, but that's part of engagement as well. So we can cut patient populations in many different ways. We can look at them culturally. We can look at them based on career choices. For example,
Sure.
first responders may have certain needs, teachers may have other needs. We can look at them in age cohorts.
Demographics.
Exactly. And that's part of Holy Name's goal as well. So as we do these patient engagements and we do these outreach activities, what type of data are we gathering, and how can we utilize that data in an intelligent way?
Kristen, I want to thank you for joining us. Kristen Silberstein is Vice President of Patient Engagement, Chief Experience Officer
Yes.
at Holy Name Medical Center. Thank you so much.
Thank
Important
you so
stuff.
much. I
That was great.
appreciate it.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the Healthcare Foundation of New Jersey, NJM, Choose New Jersey, Seton Hall University, Qualcare Inc., New Jersey Sharing Network, and by Gary's Wine and Marketplace. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.